Please forgive me doing a short video rather than writing a long message to you all, but I'm conscious that you've had a lot to read today. So we wanted to get something out to you quickly, letting you know what we've been up to. So you'll have seen the headlines today. The government's launched its brand new 10-year plan for the NHS. I've just been on the NHS England webinar discussing the same topic. Excuse me, and it's been described as one of the biggest shake-ups in decades, and that focus is going to be on moving care closer to home, improving access and rebuilding trust in primary care. The idea of creation of neighbourhood health services is bringing all those diagnostic, mental health care, rehabilitation and long-term condition support into our communities. And in some cases, they're saying that will be under one roof. The plan talks about opening services in the evenings and at weekends and offering more joined up and personalised care for people with complex needs. The more cynical amongst you might say that sounds like general practice, and the general practice that we lead and manage on a day-to-day basis. We're also seeing that there is some strong commitment to workforce reform. There's mention of training thousands of family doctors, as well as expanding multidisciplinary teams and reforming hospital outpatients to reduce the burden on primary care. They often talk about left shift, and that's a term I think we need to get used to. We haven't yet seen mention of leadership, staff training or funding. And of course, on paper, this sounds positive. It reflects the direction of travel we have been advocating for: neighbourhood level care that's more accessible, responsive and community driven. But let's be clear, this kind of transformation doesn't happen without the people who lead and manage those services every single day. Practice management is not mentioned in the plan, yet we are the ones coordinating all those things: the buildings, the teams, the rotas, the safety checks, the finances, the digital systems, and most importantly, the patient experience. We don't just keep the wheels turning, we make sure that that whole engine runs. So we find it encouraging to see the national recognition of primary and community care. We can't allow this plan to be built on the backs of already stretched teams with unrealistic expectations and no voice in the design. At the IGPM, we're calling for proper recognition of primary care management as a core leadership role within neighbourhood teams. That means clear career pathways, fair funding for our services and a seat at the table in local and national planning. We're also going to be watching the detail of this plan very closely, because we all know what happens when big ambitions meet clunky rollout with limited resources. Over the coming days and weeks, we'll be analysing what this plan means for independent GP partnerships, for primary care networks, and about the workforce behind it all, and that workforce is you. We're delighted to say we've been invited back to Parliament later this month. This time we're going to meet the Health and Social Care Select Committee to share our views on the NHS 10-year plan. We'll be raising our members' concerns and highlighting opportunities to ensure the implementation is genuinely fit for purpose, shaped by the views of those who will be tasked with delivering it, and that is you, the primary care managers. We'll be inviting our members to shape our formal response, and we'll be pushing hard for the IGPM to be recognised as a key stakeholder in delivering this new future. So if you're a member already, thank you. And if you're not, now's the time to join us. We're stronger together and we want your voice at the heart of everything that we do. Thank you for everything you do, especially on days like today when the news feels big and challenge is everywhere around us. But change is possible, particularly with people like you sitting at the table. and we'll keep fighting for you as we have done over the last 4 years. Thank you all.